Hello and welcome to the U.S. Department of Housing and Urban Development, or HUD, Grantee Fundamentals. I'm Chelsea Mandel with Public Impact Partners. We created this series specifically for the Planning Council and their Virginia communities, but it's available to anyone who's interested in tuning in. The series is designed for both new and prospective HUD grantees, so whether you're managing a HUD grant for the first time, maybe you're taking over an existing project, or you're just trying to make sense of HUD funding. We break HUD topics into manageable sessions so you can build knowledge, but you can do it at a pace that hopefully doesn't overwhelm your schedule. Our goal is that by understanding these HUD fundamentals, you can spend less time managing grants and more time focused on your mission. Today's session is Startup Essentials for Continuum of Care, or Emergency Solutions Grants Applicants. We'll focus on key things you need to know and to be thinking about now to position yourself for success as a Continuum of Care or Emergency Solutions Grants grantee. I do want to clarify what we mean and don't mean by startup essentials for this session. We are not going to cover every program or financial requirement or regulation. We're not going to walk through how to apply for CoC funds. We won't explain all of the policies or outline performance expectations or dive into reporting and monitoring. We will focus on those in later sessions. What we will focus on is some bigger picture ideas to help your organization start thinking about what is entailed with CoC and ESG funding. We'll think about some key ideas, key concepts, so that if you do want to apply for CoC or ESG funds, you've at least already started to think about what it might mean for your organization, and you've started to think about how to position yourself for success. We'll cover 7 startup essentials. Learn housing first strategies, understand the local coordinated entry system, engage with HMIS, which stands for the Homeless Management Information System, prepare for HUD systems like HUD databases, explore trainings, develop a compliance framework, but still be creative and problem solve. One of the key startup essentials for CoC and ESG applicants is learning about housing first. Grantees are measured on housing outcomes, and at the end of the day, every program is working toward ending homelessness. Housing First is one of the most significant and widely referenced frameworks among homelessness experts. People's stories and the data tell us how central housing is to folks' lives. Substandard housing is linked to higher rates of asthma, homelessness to shorter life expectancy, housing stability to greater vulnerability to trauma and violence. When housing is stable, it creates the conditions for everything else to stabilize too. And that is exactly what Housing First is about. It is an evidence-based approach that helps people access permanent housing quickly and pairs it with optional supports. Housing comes immediately. It does not come after somebody meets a set of requirements or achieves a certain milestone. And it is not denied because of factors like income, substance use, mental health conditions, or legal history. Folks still meet standard lease requirements just like any other tenant, but their personal history or their engagement in services doesn't determine whether or not they can access that housing assistance. The evidence for Housing First is very, very strong. It is widely recognized as effective because extensive research shows us that it leads to quicker exits from homelessness and it leads to greater housing stability and retention rates. So if you want to do what works, Housing First is the proven approach for you to model. Housing First is guided by some core principles: immediate access to housing, participant choice, recovery-oriented and affirming support, participant-identified needs and individualized services, and fostering social connections and community. I'm not going to go through these principles today because that isn't the purpose of today's session, but I do want you to leave knowing that if you can dedicate some time to really get curious about these, maybe that's seeking out trainings or talking with peers, you will find that there are very real, very practical ways to incorporate these principles into your day-to-day operations and see better outcomes for your participants. There's been a lot of talk about Housing First and HUD, so I want to look at the history of Housing First and how HUD has used it. Housing First did not appear out of nowhere, right? There was a large pool of research that shows that this rapid placement into permanent housing combined with voluntary services produced far better housing outcomes than the traditional, the more rigid treatment first or housing next approaches. One of the earliest studies you can look up if you're interested in reading about this is the 1990s Pathways to Housing Studies. You could also do a quick Google search to pull evidence by searching Housing First and the National Alliance to End Homelessness or Housing First and the Urban Institute, and those will take you to links of dozens of other studies as well about the effectiveness of Housing First. In response to this research, the standard model of addressing homelessness evolved. Housing First spread and started replacing these treatment first or employment first approaches, and research consistently showed dramatically better outcomes. HUD started to adopt Housing First. They integrated Housing First principles into their programs in the 2000s, like providing clear direction and briefs about Housing First principles. Then in 2009, the HEARTH Act reinforced Housing First, not by explicitly defining it, but by talking about proven models like permanent supportive housing, which used Housing First approaches, and also by emphasizing the importance of housing outcomes. Over time, HUD created requirements to elevate Housing First. CoC and ESG guidance, notices, and reporting requirements tied funding to Housing First, so communities weren't just encouraged to apply it, they were really incentivized and in some cases even required to apply it. The impact has been very, very real. More people are being housed than ever, and communities have been building more coordinated, more effective systems to end homelessness. Some community members and even policymakers question whether Housing First really works because they still see homelessness in their communities. And that's a very fair question, but the answer has two parts. First, Housing First works, but it hasn't been scaled enough. Programs using this approach have been extremely effective. One of the earlier studies I mentioned just a few slides ago found that after 5 years, 88% of Housing First participants were still housed, compared to just 47%. Another example among many is a 2013 study that found that 73% of folks with severe mental illness were still housed, compared to just 31% of folks who didn't have that Housing First intervention. And as just one other example, a 2020 review of over a dozen studies found that Housing First supportive housing programs decreased homelessness by 88%. Housing First works for folks who access it, but it isn't available at a large scale. Second, our homelessness response system has increasingly embraced Housing First. Not every organization or community implements it perfectly, but the system has shifted significantly and more people are being housed than ever before. But there are simply not enough affordable homes. According to the National Alliance to End Homelessness, for every one person who exits homelessness, about 3 more are pushed into homelessness. So this means that the system is working extremely hard. Housing First is incredibly successful in ending a person's homelessness, but the scale of the housing crisis is keeping more and more people in that system, because just as people exit it, more people enter it. Now, it is important to acknowledge that federal priorities can shift, and in this moment, we are seeing them shift in real time. The evidence for Housing First is still strong, and the leaders and the experts who know Housing First are still vocal champions of it because of the strong evidence. But I won't pretend like we aren't seeing shifts at that federal level. For example, the 2025 CoC Notice of Funding Opportunity, or NOFO, that came out in November of 2025, removed Housing First principles and even promoted approaches that actively worked against those principles. The NOFO was legally challenged and it was withdrawn in December, By the time this video is watched, there will likely have been even more developments. Some might be real policy decisions, others might be rhetoric or announcement that haven't been reflected in policies. Regardless, executive priorities do shape how funding is used, and sometimes evidence doesn't always drive those funding decisions. Regardless of current federal priorities, what exactly does Housing First mean for you? The key is to understand Housing First principles so that you can provide the best care possible and so that you can be a leader in this work. Again, the evidence is strong. The more you know about these principles, the better outcomes you can have for your participants and your community. You also want to know your mission and know your program goals. When you know your goals, you can determine whether a funding source, like a HUD source, can or cannot be used to advance your goals. CoCs play a huge role in how HUD priorities are applied locally, so seek their partnership, seek their expertise as you work to implement your programs. Stay informed on federal priorities, and remember, housing outcomes matter greatly. If a funder like HUD were to limit the use of Housing First principles, you can still keep housing at the center. You can still put people first. You can still focus on housing in creative ways, right? You can still treat people with dignity and treat them with respect. Plus, regardless of whether Housing First is being talked about or not, HUD does expect you to report on housing outcomes. So again, focusing on housing is extremely, extremely important, regardless of whether Housing First principles are being encouraged or used to full fidelity. Another key startup essential for CoC and ESG applicants is to understand the local coordinated entry system, because ESG and CoC grantees must use coordinated entry. Other organizations can use coordinated entry as well. It's not just limited to grantees, and it's actually encouraged for every provider, but it is a requirement for ESG and CoC grantees. So what exactly is coordinated entry or coordinated entry system? It is a term that describes a community-wide process. This process is when organizations are working together to assess people's needs and then connect them to housing and services. This coordination replaces siloed work. Instead of just one agency working with one person and offering whatever housing they happen to operate, all agencies in the community work together. They talk about the resources they have in the community. They look at all people in the community who are seeking assistance, and then they make matches based on the available resources in the whole community and the person's needs. So it's all about connecting folks to the best housing option for them in the entire community, not just connecting them to housing that the first agency they walked into happens to have. It's also designed to reduce the burden on folks seeking support. For example, folks do just one assessment to enter the system instead of needing to visit multiple agencies and do multiple assessments and potentially repeat very personal stories over and over. When a community doesn't have a system like coordinated entry, it can be extremely hard for folks to navigate resources and also for providers to be effective. A person might go all over town trying to connect with different providers. They could be discharged from a hospital back into homelessness. Maybe they find a place to stay for a little while, but it's not the right fit and they don't have support, so they end up back on the streets. Eventually, they might find an agency with housing, but maybe that housing doesn't work for them. Or maybe they never even come into contact with a provider that offers housing assistance. With a coordinated entry system, the process is a lot clearer for folks. Providers are sharing information, they're looking at all available resources they have, and they are assessing the person's needs so that they can provide whatever resource makes the most sense for that specific person. So what does a coordinated entry mean for you as a CoC or ESG applicant? Well, if you become an ESG or a CoC grantee, using coordinated entry is required. If you haven't engaged with coordinated entry yet, it is time to start thinking about it. It means coordinating with your local CoC and other partners and it means shifting from an agency-only mindset to a community-wide mindset. You are not just running your own programs and your own priorities. You are part of a bigger team that follows a shared assessment, shared prioritization, and shared referral process. So this can really change how you engage with folks, right? Because you are now working with folks based on what they need and what your program offers, not based on who happens to walk into your doors. This means more coordination and more access to the right housing opportunities for your participants. But it can be a culture shift to go from this agency-focused to community-focused mindset. So I do encourage you to connect with your CoC to learn more and to see how you can get engaged with the coordinated entry system. Another startup essential is engaging with the Homeless Management Information System, or HMIS. ESG and CoC grantees are required to use HMIS for data entry, but like coordinated entry, even if you're not a grantee, you're still encouraged to use HMIS. HMIS is a centralized system that's used to collect and report data. For example, data on the type of housing a person is in or the types of services they're receiving. HMIS has to meet federal standards from HUD, but it is run locally, which means that each CoC selects an HMIS software that works for their community while also meeting HUD-specific requirements. Unlike the point-in-time count, which is a snapshot of folks who are homeless on a single night, HMIS gives a much more comprehensive and year-round and real-time picture of homelessness. If you are what HUD calls a victim service provider, or VSP, meaning your primary mission is to provide services to survivors of domestic violence, you cannot use HMIS because you don't enter personally identifiable information into shared databases like HMIS, but you are still required to use a comparable database that meets HUD requirements still. So what does HMIS or a comparable database mean for your organization? First, it means coordinating with your local CoC and your HMIS lead agency. If you become an ESG or CoC grantee, again, participation in HMIS is required, so you become part of this broader coordinated effort. It also means meeting data entry, data quality, and reporting requirements. And because of this, HMIS becomes a very regular part of your workflow. And you'll need to complete required trainings and user agreements to ensure proper system use, security, and participant privacy. At the same time, you will now have data at your fingertips, and you can leverage that data to help measure performance, to demonstrate outcomes, and to help inform your decisions. Instead of relying on your best guess of what to do or making decisions based on how things have always been done, you now will have more information to help guide those decisions. It can also strengthen your organization and your community-wide planning, again, because you have much more information. And using HMIS can greatly improve your participants' experiences because of features like electronic document storage and features like documenting each participant's service history. Another startup essential is to prepare for HUD systems and tools. If you receive a HUD grant, you will soon be exposed to many software systems. For example, ELOX is HUD's main grant disbursement system, and grantees use that system to draw down funds. SAGE is HUD's quarterly and annual reporting system. Grantees use that to submit reports. eSnaps is HUD's application and grant management system for the CoC program, so applicants will engage with that system many times. And depending on the type of program you manage, you might be required to use some other systems as well. For example, IDIS is a reporting and drawdown system for numerous formula grants like the ESG program. So what exactly do HUD systems mean for your organization? Again, coordination. You will be required to use HUD systems to provide information to both the CoC and to HUD as well. And if you are a recipient who has subrecipients, you'll also be coordinating with those subrecipients to provide information from them into the HUD systems. You'll also be required to use systems for reporting, for drawing down funds, and for grant renewals. HUD expects you to use these systems properly and to know what is due and when they are due. And planning ahead is absolutely key. If you don't have a grant now, you won't know the details about the systems or who exactly should use them at your organization, but it can still be helpful to look at your organizational chart, look at your positions, and at least start thinking about who would handle financial reporting and who would handle program reporting. The next startup essential is to explore trainings. ESG and CoC applicants and grantees should explore training now and expect to need more training in the future, especially if you are new to your particular project type or to federal grants in general. As a new ESG or CoC grantee, you really should plan for this training right away. There are a few core areas where HUD and the CoC expects you to have staff knowledge and competency before you even begin providing services. First, you absolutely need training on housing and shelter standards. These standards vary depending on both the program, so whether it's ESG or CoC, and also the program component and activity. For example, inspections for permanent supportive housing, or PSH, under the CoC program are very different than assessing a shelter facility under the ESG program. You also need to understand what documentation is required to evidence your compliance with these housing and shelter standards, like inspection records and lease documentation. If your units or your facilities don't meet these standards, you might be required to make repairs or to remove units, and you might even risk funding altogether, so it is very important to understand this early. Inspire is the newest set of standards. Inspire is fairly new, and it's designed to consolidate and streamline standards that previously existed across tons of regulations. You'll really need to understand Inspire in order to operate your CoC and your ESG program correctly. You also need training on Section 504 and accessibility. This is all about ensuring your program is accessible to folks living with disabilities. There are numerous 504 tools available to help grantees comply. For example, many recipients will distribute 504 self-assessments or checklists to folks to help guide staff through evaluating their facilities and evaluating their policies against those accessibility standards. You also need training on HMIS data and privacy. I mentioned this briefly earlier, but your staff need to know how to enter data correctly, how to maintain data quality, how to protect sensitive information, and how to follow security and confidentiality requirements. HMIS is not just a software system. It is a performance tool. It is a compliance need as well. So getting this right from the start is critical. Finally, your team needs training on ESG and CoC program rules. This includes understanding eligibility requirements, understanding what documentation you need to collect, how to report to HUD, and how to stay compliant with other federal regulations. So what exactly does training mean for your organization? It means taking the initiative to identify and pursue support. Think of this like onboarding your program. Start by asking yourself, what do we need to know to stay compliant, to operate smoothly, and to best serve our participants? It also means coordinating with CoC leadership and, again, the HMIS lead agency. Reach out to them early. They can help clarify expectations, they can provide guidance, and they can loop you into existing training resources as well. Also, establish clear requirements and defined staff roles. Be very clear internally about who is responsible for what. When roles are defined, it's a lot easier to match staff with the right training. From there, build a training plan. This doesn't have to encompass everything. It absolutely does not need to. You just need to start somewhere. You can start by setting up a quarterly 30-minute meeting with you and your teammate to identify a training need, and maybe you just start with identifying one resource to use. Finally, commit to ongoing quality improvement. Training is not a one and done situation, right? Build in regular check-ins to review data quality, to answer questions, and to strengthen your processes over time. Another startup essential for CoC and ESG applicants is to develop a compliance framework, because if you are a CoC or ESG grantee, you are expected to follow numerous regulations and requirements. Federal funding comes with requirements and comes with limitations. Accepting a CoC or ESG grant means agreeing to follow federal rules on how the money is used and how it's reported. Internal systems and controls help with compliance, and strong processes make grant management smoother and reduce risk. Financial management and internal controls are required. For example, 2 CFR Part 200 is a section of the Title II Code of Federal Regulations. CFR stands for Code of Federal Regulations, and this lays out uniform guidance for federal awards. It lays out everything from how long you need to keep your records to separating within your organization who is approving spending from who is actually handling the money. You also need to be prepared to work within multiple governing documents. Regulations set the foundation. In an earlier video, we talked about how 24 CFR Part 578 is the CoC regulations, and Part 576 includes the ESG regulations. HUD notices provide additional detail or conditions that grantees need to be aware of. Your grant agreement defines the specific terms of your grant. Your policies and procedures guide daily operations. And there are other documents involved that as a grantee you need and you will get very familiar with. The key takeaway is that managing federal funds means operating within a specific structure, and that structure is set by federal rules and federal guidance. So what does it mean to have a compliance framework for your organization as a prospective grantee? Again, coordination with the local CoC and with HUD. HUD and your CoC will monitor your activities for performance and for compliance as well. If you are a recipient and you have subrecipients, you also are expected to monitor your subrecipients. This also means avoiding assumptions about what is or isn't allowed. Also, having clear internal systems and controls to ensure activities are allowable, that they're tracked and accountable. For example, do you have a way to track staff time? Do you have a central location to store your documentation? Can you show how you spend money? These are the kinds of questions that compliance answers in practice. And finally, being thoughtful about your planning. HUD does not fund everything, right? Knowing what is allowable and what's not allowable before you spend the money can save you a lot of stress later. The final startup essential is to remember that even with a clear and very real compliance framework and compliance needs, you can still keep your creativity and your problem-solving skills. Federal rules set clear guardrails. They define what HUD funds can and cannot be used for. Sometimes those rules can feel very restrictive, but other times they can leave room for interpretation. The key is knowing what the boundaries are and then being thoughtful about how you can work within those boundaries. HUD funds can't pay for everything. You cannot use them for every single activity or every participant need. But oftentimes there are opportunities to be creative or to problem solve without breaking the rules. Just a couple of real-world examples come when thinking about match and when thinking about gift cards. Starting with match. Say you are an ESG subrecipient and your project requires match, and you know your organization doesn't have enough cash to meet that match requirement. You might initially think that you're not eligible or feel like you can't apply for that money. But instead of giving up and thinking you're not eligible, you take a minute to go look at the regulations, look at HUD's website, look at ESG match requirements. You learn that you can use less traditional sources for match, like volunteer hours or other in-kind donations. You don't have to use cash to meet that match requirement. If you can count these towards your match, you're able to meet that requirement potentially. So that's just one example where initially you might have fearfulness or disappointment about not being eligible for something because you think you can't meet the match requirement. But if you spend a little time digging in it more and trying to solve the problem, you find that maybe you can meet that requirement after all. Another example is about gift cards. Gift cards are generally not allowed with HUD funds. There are very specific circumstances, but generally it is very rare that they are allowed. I heard a story once from a subrecipient who wanted to provide gift cards to participants to help them purchase clothing. The recipient told that subrecipient that they wouldn't reimburse them for gift cards because gift cards weren't allowed. But instead of stopping there, the subrecipient and the recipient took a little time to talk and to get creative. They decided that instead of giving gift cards to folks directly, they would contact the store and they would set up a relationship with that store where folks could go in, could choose what they wanted from approved items, and then the agency paid the store directly. Participants still got what they needed. They still got the clothes and they still had a choice in that clothes, but the agency didn't have to do that through gift cards. And by paying the vendor directly instead of providing gift cards to participants, the agency was able to stay in compliance. So, what exactly does this mean for your organization? Again, don't make assumptions. When something feels like it's unclear or it's impossible, always go back to the regulations, go to notices, go to guidance. Sometimes requirements can be limiting, but other times they can give you more flexibility than you might think. Next, plan ahead. Know what is and isn't possible before you design a program or spend funding, because that will save you time and stress and rework later. It's all about balancing rules and creativity, so really figuring out how to meet real needs while still following the requirements. You also want to plan on collaborating with others. Partnerships helps you expand your impact, especially in times when HUD cannot cover everything on their own. And finally, communicate with your peers and learn from your peers. Other providers have already faced many of the same challenges that you would face as a grantee, and there is a ton of value in learning from what's worked and learning what hasn't worked. With that, thank you for tuning in to these 7 startup essentials, and thank you for the leadership and the care you bring to this work.